Hi, I'm Virginia Sy from Synergy. I'm the nurse, and we're here with a roundtable today again. We are discussing how to make a house into a safe and functional home. And so we have a lot of people here representing our community, and they all do very different things in the community to help make that house into a place where we can be safe and we can function as long as possible. So I'm going to start by just asking you guys to introduce yourselves. So we can start that way.
Okay.
Yep.
Hi, my name's Kara Caskell, and I'm representing Sunnyway Senior Living Partners.
Hello, my name is Keishorna McConnell. The program is basically BCAUSE Civic Works.
Hi, I am Hital Shah. I'm Doctor of ET and owner of Synergy Homecare.
Hi, I'm Kashala Cole. I work for Safe and Home. We provide remote support services.
Awesome. So just thank you so much for coming today. This is going to be quite a great discussion. I haven't had 4 people yet. I've only had 2. So the first thing I just want to ask you guys, and we can go this way, is how long has your company been around? And then just how long have you been in the community seeing like people in the home?
So thank you for having me. We have been in service for about 15 years. I have personally been working for Safe and Home for a little over 5 years. So I have been in individuals' homes for, like I said, about more than 5 years.
Okay, and if you could just say like really quick, just one line of what you offer to the community, like what would you say?
So we offer remote support services, which is going to increase individuals' independence. It provides technology and direct support for individuals who don't need hands-on support necessarily. So we provide that remote piece, that virtual support as well.
Yeah, another option for independence.
Yeah,
having somebody
increasing.
physically there with you.
Absolutely.
Awesome. And he's all the owner of Synergy, but also here representing. What do we do kind of to help in the home that you would say?
Yeah, so Synergy is a year and a half old, so we're very young, but I have over 20 years of healthcare experience as a PT and population health manager. So I personally do home assessment for all the families. That's when I go in and do a fall risk assessment. I assess the house to make sure it's safe. And I think we'll touch on this, but we actually go into the patient home before they get discharged also. So we start very early on and rely on, our ecosystem, work with them on making sure the patients are independent and safe.
Yep. And making sure they have all the equipment that we have as beautiful backdrop for us today, right? Okay. And Kishorna,
Yes.
how long has Be More Civics and BCAUSE been around?
Yes, well, thank you for inviting us. So BCAUSE has been around, been founded since 1993. Civic Works, 1993, and our program is BCAUSE.
Mm-hmm.
We basically help the elderly 65 and older in Baltimore County with home repair. So we basically hit 3 areas. We have the home repair, then we also have the accessibility, such as grab bars, handrails, and then lastly, case management. So that's what we do, yeah.
And how long have you personally worked for them?
Oh, and I've personally been working with them for less than a year.
Okay, well,
Yes.
welcome.
Thank you.
And Karen.
Yeah, so Sunnyway's a younger business, similar to Synergy. Sunnyway's been around for about a year now, but I work alongside my father, who's my business partner, who's been supporting seniors through the downsizing process for like 20 plus years. So it's super cool. We have the experience to back a lot of my enthusiasm and my energy that I'm bringing to Sunnyway. So
Yeah, and did you tell me on the phone like you just recently like really officially took it over from your dad?
So Sunnyway's mine.
Okay, yeah.
Sunnyway's my business.
Yeah,
I'm the owner. He kind of had a side hustle.
That's what I'm
in addition,
remembering.
yes. So he worked in IT, and so last October he retired from his 9 to 5. But in addition to working in IT, his day job, he would support seniors through downsizing. His bread and butter is really the content, the stuff. He helps people identify items of value, and what do you do with all this stuff is the big question, right?
Yeah.
So back in the fall, he retired from that, and he had already had some experience and a little bit of a network, so that when I dove in and built Sunnyway around, we expanded on the services, and we can talk in more detail later. But Sunnyway's mine, and we built that around his, around kind of his model that he had built.
I love entrepreneurship. Like you find a niche for what the community
Yeah.
needs,
Yes.
you go with it.
Yeah,
So,
absolutely.
That's awesome, congratulations.
Thank you.
So the first thing I wanted to really talk to you guys about is we're all in the home.
Yes.
So I want to kind of, and we don't have to go in order, but what are you seeing that you find in the home that makes people scared to be in their home? Once, like, they might decide that they have to leave their home. Like, what are some of the problems that you see in your respective companies when you go into the home?
So one of the things that we see, we have a lot of individuals that need the grab bars and handrails. We see a lot going on in the home, and they want to stay in the home. They want to age
You want to stay in the
gracefully.
home.
Yeah, they want to age gracefully in the home. They don't want to go anywhere else. So that's the biggest thing. Even in the showers, in the tub, the bars, that's important. That's what we see. That's the biggest thing that we see,
They're
accessibility.
afraid of falling.
Yes, aging in place, right? They
Yeah.
age in place.
That's what it is.
And I know a lot of us are talking like towards like the elderly population today, but I do want to kind of say like a lot of our services could be for disabled clientele. They could also be for, special needs children, like some of our services offered in the home. So we just want to kind of speak to that if your services are able to do that as well. So what else? What else have you guys seen in the home that you're concerned about?
So we do provide services for individuals with intellectual disabilities as well. But a lot of what we see is isolation. So a lot of the individuals, right, we work with is isolation, and that is a really huge issue, right? And that causes a lot of issues just with mental illness as well. So we talk about the isolation piece of it, which is why we love the remote supports, because we have our remote support specialists that will check in with individuals. We will do these support calls just to make sure they're okay. So isolation is big, it's huge. So, and that leads to all these other things. That can lead to falls, and it can lead to all of these other issues. So isolation is a really, really, really big one. Having someone to reach out to, making sure that
Right away.
everyone is okay. Yes, yes.
What are you gonna say?
Yeah, I was kind of on the same note there with the emotional sort of overwhelming. It's a lot of anxiety that comes around content and stuff, and so whether someone is staying at home or in our case, a lot of our clients are moving. There's a lot of concerns about like how do you get the heavy furniture out that and especially if the kids don't want it, right? It's a lot of that emotional turmoil that we're coming across that prevents people from, if they've decided they do want to move, it prevents them from taking that step, because trying to figure out what to do with everything. And one of the things that one of our big philosophies is keeping as much out of the landfill as possible. That's a big thing. Nobody likes the idea of all of their stuff ending up in the landfill, but a lot of times that's the path of least resistance. So the kids come in and they don't know what else is out there, right?
Right.
So I think the isolation and just the emotional anxiety and kind of that agony and stress about just the amount of stuff that you accumulate in a lifetime.
And you can't, especially if you're downsizing, but I would even argue even if you're staying in the home.
Even if you're staying in the home,
all that clutter becomes dangerous.
it does. It can be a hazard.
Over it,
Yeah, absolutely.
Right?
Yes.
So it's like, where do they put all this?
Yeah.
Where do they do it all?
Everyone's got stuff. That's another thing I come across a lot of people.
I've got stuff.
Everyone's got stuff.
Right.
People feel like they're the only one that has a basement full of stuff. And I'm like, if it's not in their basement, it's in a storage unit that they're paying for, but everyo's got stuff. So, yeah.
So I want to add one more thing is isolation is a big one, but we'll talk about disease progression, right? It's super confusing for the families and the person who's suffering with things like Parkinson's, Alzheimer's, not knowing what's going to happen. And that's where we usually are trying to be very proactive. So say somebody's in the hospital, they don't know how they're going to feel and do when they go home.
Yes.
And this is why, we at Synergy work with a social worker first, understand what their discharge plan is. I usually go with the families before they get discharged, go to their house and understand, hey, what do we need? Grab bars, or to your point, if there's a lot of clutter, are they gonna be able to navigate through the house and just really make sure the house is safe for them? Number two is educate them, right? I just went to a home assessment this morning. He was a doctor of PT, had Parkinson, and he's falling once a week. So it's medication, progression. So really kind of understanding what they're going through, and then making sure the house is safe. They have a stair lift, they're looking at the elevator,
Yes.
they might need to downsize and go to like a one-level house.
Yeah,
You know,
Yeah.
we see that a lot,
Yeah, exactly.
Yeah.
So I think those are like some of the things I would touch on is when I go, and that's why I do 100% home assessments as a PT and as an owner, because I do want to understand the house is safe. When they progress in a disease, they're educated on what they need. What they need.
And then it becomes their choice of what they want to do, but at least they have the
Absolutely.
resources.
Yeah.
So, I'm a geriatric nurse practitioner, and I think what I love that all of you are talking about is I'm very much pro aging in the home. I'm very much pro staying in the home. You know, if you're intellectually disabled, special needs, anything. And what I love, I think that we're all talking about is in our own ways, we have found a way to make the home fit the client
Yes.
versus forcing the client to fit their home.
Yes.
And I think sometimes like when you are the person in the home, you don't even know what you don't know. You don't know what's unsafe. You don't know all these resources that are out there, which is why I love doing these roundtables, because we're bringing these resources to the community, and you just feel lost. Like you don't know what the next step is, and then you end up getting hurt.
Right.
Yeah. So I want to now kind of just push us into what does your company like actually offer to be able to support in the home, and we don't have to go in a row, but whatever anybody would like to start, just kind of tell us how you can support them staying in the home.
I'll start. So we offer several things. So it can be, we have different types of sensor technology, where it could be kitchen safety, for instance, for a lot of whether it's our individuals that are aging, or individuals with intellectual disabilities, where we'll do things like kitchen safety for if there's a stove that's left on, for instance. It will send an alert to our remote support staff, or it'll send an alert to a natural supports to say, hey, you might have left the stove on. So it'll detect heat in the kitchen to say, so it can send an audible alert, or it'll send an alert to us to let us know that heat was detected. So it'll be something like
I
that.
heard Sean talk about that at that online roundtable we were at. What a great
That's
idea.
huge.
Because that's one reason why people keep going back in their house,
Yes.
is to make sure, did I turn off the stove?
Did I turn the stove on?
I do it now, and I'm like,
Right, I do with it. I mean,
can I sign up?
I know, seriously. I mean, it's just one of those things,
Yeah.
right? So it's something, something like that. We have those types of things. We have different types of sensors to detect falls. We have wearable devices that will
Yes, I remember that.
detect falls as well. Safety buttons that you can place around the house, or a wearable safety device. So if someone does fall, you press a button, you can immediately talk to our remote support staff. We have medication management, medication devices that will send an audible alarm to tell you when it's time to take medication. And we couple all of this with our remote support staff. So we will provide a tablet where our remote support staff do these support calls to check in on individuals, to make sure everything is okay, and we'll do reminders as well. And all of that comes with our remote support staff. We have support plans for all of our individuals, so we know exactly what they like, what they don't like. We can just have conversations to make everyone feel like loved and at home, and all of the things. So lots of different things.
That's a nice option when, because all of this comes to finances a lot of times.
Mm-hmm.
For somebody that maybe can't support a live-in caregiver
Right,
24/7, you could be partnering with like us,
Absolutely.
to be like, well, they can't have us in the home all the time, but then you have the remote service when we're not there, right?
Absolutely.
And I feel like, was Sean also talking about the locator device if you have like an older dementia patient,
Yes,
family member, if they go wandering, you can find where they are?
absolutely.
Okay,
Any of
I
our
remember
wearable
talking about that
devices,
too.
any of our wearable
That one
devices
has
have
it.
GPS. Yes.
Interesting.
They have GPS, and we can locate individuals, and we can talk to them. And a lot of our devices they have automatic answers, so you don't have to worry about a cell phone where it takes an individual
I had no
to do
idea.
that.
Did you guys
Yeah,
have
it's
any idea?
automatic
Okay.
answer. We
Yeah.
call and it automatically answers, so we can talk to them immediately.
Yeah, I
so they don't have
usually
to
use
press the
them like
device.
Live 360 and stuff, but that's not like variable. So
It's
this
not,
is
yeah.
super powerful. This is
And then just
super-
tell them, real quick, where they can find you.
So it's safeandhome.com. Really, it's that simple. www.safeandhome.com. Yep.
Who wants to go next?
Wonderful. I can go next.
Sure.
I'm
next
done
on that.
next. So I think, so I already touched on, how we do home assessment and proactive, but 3 things I want to touch on. One is the home assessment where, one thing I always talk about when I opened Synergy, I was like, what's my differentiator? And I said, at Synergy, I believe like we just don't deserve a caregiver, deserve a care team, right? That's why Virginia is with me and we are super clinical here. But it's just not us, it's you guys too, so this is super
Yeah,
exciting to me.
I like to
because-
call this a care
Care
ecosystem.
ecosystem. And I
Love
love
it, love it.
So when I do home assessment, I take a step back. I'm like, I wear like almost like a clinical liaison hat. Like, what does this client need?
Yes.
Like, what can they afford? And what do they want to do? What are their goals? So when I go in there, I talk about, of course, home care services, but also talk about different options with different things, right? So I'm hearing things, it's all in my mind when I'm thinking about a home assessment. Second, the care plan. When Virginia goes in as a care plan, that's when we have, memory care exercises. We have brain exercises. My caregivers have a very solid prescribed care plan that talks about what to do, what not to do, and there are care notes. We read them every day here in the office, and we see anything. So one of the things we saw was the client let us do one last week. So I had a conversation with a daughter, and now I know that there's something available.
Yeah.
So that's what we are constantly doing here, is how do you make sure the client is safe? So being proactive, but then also looking at the care notes, every week we do the clinical verification report. So we're really actively working with the client, understanding what their needs and evolving needs are, and then connecting them to the resources that,
Because we all have our niche, we all have our special
Yeah.
needs.
Absolutely.
Yeah, that's nice. I like that.
Love it,
Yes. Well, with BCAUSE, the program, we basically do home repairs at no cost. So, and it starts off with just finding out what the client needs, what the homeowner needs, and affordability. That was one thing that you had stated. Some individuals cannot afford to get the electrical or the roof done. We do, we don't repair, we replace a whole roof. Some people can't afford that. Electrical, plumbing, so it's more than just accessibility, it's safety. We have individuals that cannot even open the door, maybe, their windows, certain windows that can't open or close, that's safety. So, and what's so great about it is that, yes, it is, you have to qualify 65 and older, depending on how much you make, but it's out there and it's free. It's actually free. So that's the one thing. And then we have our contractors. The individual the homeowner do not have to go out and find a contractor, because that could be something else
That's-
too.
That's
You can
nerve-wracking.
That
to find
is,
somebody.
yes.
You can find someone and then they pay, and then they may not be as savvy, or they're older, they can't continue to call and run up to someone that just took their money.
Right.
So they don't have to worry about that. We have in-house contractors, and then we partner with contractors too. So that's another great thing that we have. And if it's safety, anything to do with safety, we're there, number one. So we have our contractors go out and assess the property and go from there, So how they can get in contact, they can call Baltimore County. That's one thing. We service Baltimore County. Do I have to give you the number? But you can
Yeah,
call us.
how would we find you?
Yes,
Yeah.
the number is 410-887.
Okay.
410-887-2594. Yes, yeah. And start the application there. And then from there, case manager, they will go over the application, and then their application will be transferred over to our partnering. We partner with 4 different programs. So it'll depend on which one that it's based out to, and then go from there. So,
But the client doesn't have to navigate all that.
No.
Once they're in your system, you guys are
Yes.
navigating that. Yes,
That's
that is
what's so
awesome.
wonderful about it. Yeah, they don't have to do
When they hear
anything.
like, oh, I have to, nope, we got it.
No.
Just call us up, we got it.
Yeah, so
Interesting.
Yeah, so when you actually call and say, hey, electrical, when I turn the light on, it sparks. And it could be multiple things, but you just tell the caseworker, the case manager that, hey, I need to get this done. And the contractor will come out and assess it. You just point it out.
Yeah.
And if they feel it's the safety,
Good stuff.
So I do, oh, do you want to ask her
Quick
a
question, are you guys also in touch with Department of Aging, Maryland Access
Yes.
Point?
So that's the number that you're basically
Oh,
calling, yeah.
that's good,
yeah.
good to know, because I give that number all the time. so
Yes.
it's good that you're able to,
Yeah.
Yeah, so say what that is again.
The
Matt,
department,
you're talking about
yeah,
Matt?
I'm talking about Matt,
Yes.
yes, that was the number, Matt, yes.
Yes, yes. Maryland
Access.
Access
Access
Point,
Point.
Maryland
Yes.
Access Point, yes, great number,
Yes.
quick.
Great resources,
Yes.
yeah.
I do want to just say real quick, because your kind of counterpart for Howard County was supposed to be here today, because I know you were Baltimore County,
Mm-hmm.
but she got sick, so she did send me just a little thing real quick, so I did
Okay.
just want to say, Kishorna's from Baltimore County, but if you had a Howard County need similar, it's called the Older Adult Home Modification Program, OHHMP, and that's through howardcountymaryland.gov/CLP.
And their phone number is 410-313-1234.
Yes, and they basically will do the same thing, assessment led by an occupational therapist. You do have to qualify, but then they would come in and help modify the homes to help in Howard County.
Yes,
So, yeah.
that's wonderful, that's good to know.
That's really good.
Yeah, that brings it to me. So, Sunnyway, we help a lot of people, whether they're moving or they are in the context of, aging in place, staying at home. It really is, we're the answer to the question, what do I do with all this stuff, right? So if it's about, I just have all this furniture I've accumulated, all these trinkets, knickknacks, whatever it is, a lot of times it is my kids don't want it, and, I want to bring a caregiver in, but I just have too much stuff that to have someone work around it is, it's hazardous, right? Maybe I really just want to get an idea of what my options are. So we offer free initial downsizing strategy sessions. So whether someone's moving, whether they're staying home, we'll come out for free. And our goal is really to help people understand what items do you have of value that you can sell, put some money back into your pocket. What are some items that maybe are better fit for donation? And what are the ways that you can avoid the landfill at all costs? So we do some level of emotional support if someone's like, hey, I want to go through it and sort it myself. I just need a companion to do that. And maybe I have physical limitations, right? Maybe I can't lift that much, and I want someone to come in and help me parse through it. I've had several clients where I personally will go. I'll spend a couple hours a week, and then I will fill up my car, my Toyota Corolla, and I use every inch of it, and I'll fill it up with all the donations, and so we offer that, and then we also have haulers. We have people that we can reach out to if it's stuff that is not usable, because that's another thing, right? You get the broken desk that's in the basement that you really can't repair it, but it gets stuck down there because you can't get it up. So, and then the other thing we do is if someone has a storage unit that they're tired of paying the bill on, and they're like, it's the storage unit of stuff that either they're not ready to get rid of it and they just want to sort through it, or I just need this cleared out. I need it out of the landfill, but I can't have it here, right? So if it's something like that, freeing up that bill so that maybe that can be put towards a caregiver or whatever extra resources and support that they do need. So yeah, we have a lot of different solutions, and again, we're happy to meet anyone for that initial strategy session. It's free, it's no cost. And you can reach me at 410-989-3493. And then also our website is just sunnywaymove.com.
And one thing I really remember, when I was talking to you and
Yeah.
Sheila that day, is you were so passionate about, you're not just going in there and getting rid of their stuff. You were like,
No.
people have emotional attachments to this
Oh,
stuff.
it's and look,
And
I
you were like,
love
that's
I
why
love
my
hearing
job.
the stories.
Yeah.
That's the thing. I want to know who gave it to you, when did they give it to you, where did they get it from.
Yeah.
I love that. I love it so much, and it's important to me to know. I've had clients that have said, it makes it so much easier knowing that I can point and say I don't need this anymore, and I can trust that you're going to put it in the home of someone that's going to value it.
Yeah.
I don't have to do the thought of where am I going to take it, or what am I going to do, how am I going to, how can I get my kids to take it, how can I, it's just, I get to just point and know in my heart that it's going somewhere where it's going to be valued. And I love that I can give that peace of mind, to my client. I really do. It's my favorite part of the job.
And a lot of times we don't get rid of extra stuff because we don't know what to do with it.
Yeah,
And
yeah.
so it's nice that I have never honestly heard of a service like yours until you were at the Liberty Fair.
Yes,
That's where you came across
yes,
it.
yes.
These health fairs and stuff
Yeah.
are wonderful to
Yes.
like meet other people that can be part of your ecosystem.
It's awesome, those
So-
small business events, because
Yeah.
how else do you meet people? And you
Yeah.
get the
Yeah.
networking,
Yeah.
small business, yeah, it's
And,
great.
and we all are in the similar circles where we can be like, oh, I know somebody now
Exactly.
that can help you.
Mhm.
So I did want to mention, I had one more because my final thought here is also, as we're modifying these homes, the other thing people need is maybe medical equipment, like all these things behind us today,
Mhm.
and that can be expensive. But that's another way we can keep people at home. So I had also invited Jennifer from the Howard County Department of Aging, who is in charge of the loan closet. So I don't know if you guys know about this. The loan closet actually loans out medical equipment, and I learned online at the group meeting the other day that they also loan out like garden equipment. I would say kind of anything you need, equipment wise, maybe try to reach out to them.
And if you haven't seen it,
So-
go take a tour, by the way. Everything, is sanitized, sterilized, cleaned. They also have a training room.
Oh.
So if one of your family members want to learn how to use a horror lift, for example, or transfer board, they have training rooms. It is
Really?
really, really nice.
Oh.
Yeah.
So I went to a nursing home, patient was getting discharged and Medicare was gonna take 2 days. St. Lawrence Closet, they were able to get that equipment from them and,
Wow.
discharged.
Good to know.
That's nice.
And so that's howardcountymaryland.gov/loan closet. And yeah, I just see what they have. That might be another option instead of purchasing all that medical equipment, because that can be expensive too, especially if insurance.
And it can be
doesn't cover it for
donated
some
to
reason.
if they're,
Mhm.
when you're downsizing.
Absolutely.
Yeah,
Yeah.
people can donate it.
So, okay, well, we're gonna like just kind of wrap this up. Is there any final thoughts that you guys have that we haven't like expressed to the community or our clientele out there that you can think about?
I think we just learned a lot of resources
Yeah.
for
Mhm.
our families. I think
Yes.
that's my thought. This is
Yeah.
great. Thanks, Burge.
Yeah,
So I think all of us can kind of work
Mhm.
together and just make sure.
I think this is just the
patients are safe.
beginning, and then as we learn more resources that are out there, you know, that we can do another roundtable.
Absolutely.
So, yeah, well, thank you so much for joining me here today, guys. I really appreciate you coming and sharing all of your services so that the people that we care for can have a care team and be cared for well. So, thank you.
Thank you for having us.
Thank
Appreciate
you.
it.
Thank you.
so much. Thank you.